Hi, I'm Dr. Johnny. Thanks for joining me today. We're talking about chin dimpling. Kind of goes hand in hand with that lower face lines or rhytids that occur especially in lighter colored skin, especially after hormone changes, or if people haven't taken care of their skin with skincare, retin-A's, cigarette smoking, pollutants, all of those things. But the lower face, especially on a female, is going to be aging. And one of the things they're going to present with is loose skin if they watch themselves in the mirror, they see themselves talk, or if they have great friends that will say, hey, guess what? I'm noticing lower facial wrinkles and lines. Now, people are scared to say that. Times are changing, but it's important. Why? This is a dynamic area. People don't see that they're getting vertical lip lines until when? They're etched into the skin. Too late. We want to get you before that. So same thing with peau d'orange or chin dimpling. Most people wouldn't see it unless you're talking or expressing. And it's because the collagen in the skin, the dermis becomes thin, you lose collagen, elastin. We talk about MMPs, collagenase, all those things that eat up your collagen as we get a little older. So paying attention to the lower face and doing preventive treatments, your retin-A's, your skincare. Watch my video on your best skincare, the most affordable skincare. Goes through all the major elements to keep your skin tight. If people take care of their skin and the outer surface of the skin so it doesn't get loose or thin, the muscle movement's not going to bother people. So what we're going to do today, we're going to watch a video of the chin BOTOX being done. Look at the pattern. We're going to see the before and after and see it move, see the dynamics so we know exactly what it is we're talking about. This is a Raji quickly. Join me in 3 seconds and we're going to get into it. Okay, so it's the chin we're talking about. The muscle is called the mentalis. And again, most commonly it's forming because the skin on the surface is gotten thin, or there's just a lot of movement, and by shrinking it or atrophying it once or twice a year often helps a lot of people. So if you look at what we have in this country, we have BOTOX, dysport, Xeomin, jeuveau. We all add water to them, a form of water, to mix them. So they're all diluted per se. And if you're worried that yours is diluted, watch my video, meaning over diluted. Watch my video on dilution of neuromodulators or dilution of BOTOX, or is your BOTOX diluted? I even have one on those. So you get to understand it better. But the more dilution we use, the more water we use, the more it can spread. And the muscles in the lower face are very pointed, meaning you don't want to get the muscle that moves the lip down, which is right next to the mentalis muscle. So those are some of the problems that one could run in, but dilution, choice of product, of course, injection technique, all play a role. Let's look at the chin now. So if you see here, you see it move, you see the peau d'orange or dimpling of the chin, and then you see a smooth chin when the patient doesn't move at all. The idea is when they articulate, if we shrink that muscle down that creates that dimpling, we won't have it in speech. When people eat, they don't even know it's happening, but it certainly gets worse over time as the skin thins. So when we go to the injections now, you can see it's more of an intramuscular injection. Very important where it's placed. You can use 2 points, 4 points. People do it differently. It's the art of how people inject that determines the results they get. And every patient's going to be different. A lot of people want to try and standardize everything and say, hey, I had this done, or I had this done, had a side effect, or no one can know except your injector, the person who put it in, the dilution used, the product, the dose. If someone says, oh, you got 6 units here, how do you ever know you got 6 units? It's not like going to the grocery store and buying oranges. I got 4, here they are. You get 4 units, and 4 to 6 is typical down here. The patient would never know if they got 4 or 8. So it's all about the person who's doing the procedure and your history with them and communication, what you want to see. But maintain your skin, use your skincare, stay joined here to keep your skin and body beautiful, healthy, and vibrant.